This is another one I had to spend probably an hour just developing trust. She didn't want me to call any of her family who are in Canada, but finally, through a lot of conversations, and I realized she had some early onset or early dementia. I could tell by her nails. I don't know if any of you, when you see your patient's nails, if they're really kind of dirty and not well cared for. That's not what we typically do, so that's really actually their overall appearance and how they're taking care of themselves gives me kind of a key in where they are with their memory loss. So we did get her family, we got her to a skilled nursing facility, and then she went to assisted living. And again, we have a conversation with our home NP. She's going to visit, make sure and make adjustments to medications, and just really we're trying to keep them in the home and provide them care. So why would NPs be are so well primed for this population? I think it's because of our nursing. Our first fundamental are in nursing, when we learn to treat the whole person, when we develop empathy. We're with patients for 12 hours. You have to learn really important communication skills, and all of that with the NP knowledge really helps in this last phase when some people say, it takes a village to raise a child. I would say it takes a village in this last chapter to have a dignified last chapter of life. So, thank you.
Thank you, everyone. My name is Johnny Moyer. I'm a nurse practitioner. As you've heard from Laura, I work with the homeless, and I work for the San Fernando Community Health Center. About 2 years ago, our CEO, Audrey Simons, had the vision and the insight to partner with a recuperative care center in Mission Hills to provide a safe haven for homeless patients that have been discharged from the hospital. Currently, the hospital doesn't have a place to send them. Most of these patients are sick. They can't be sent out to the streets, but they're too well to be hospitalized further. So the recuperative care center allows them an avenue to place these patients. So what the recuperative care center does is it provides a place of lodging, a place of safety, and it gives 3 square meals a day. And our job at the San Fernando Community Health Center is to provide medical care for these patients. Now, it's been a wonderful relationship. The recuperative care center is located right across from the police station, and we're located right next to the recuperative care center, so it's a pretty safe area. And the patients that are in the recuperative care center will come to us every single day because we share the same building, we share the same hallway, and it's easy for them to come and see us for daily care. Let's talk a little bit about the types of patients that we're treating. The vast majority of our homeless patients have experienced some kind of trauma. I'm seeing homeless patients that have been shot. I'm seeing homeless patients that have been burned. I'm seeing homeless patients that have been stabbed. Many of these patients have been run over by cars. They're coming into the clinic on wheelchairs with multiple fractures. They have traumatic brain injuries. As a matter of fact, 1 week ago, one of our patients was crossing the street, and he was just going to the police department. And on his way across the street, he was clipped by a car and had fallen on the street. That car decided to just zoom off and continue and leave him there. Now what's interesting was, the police didn't see the whole thing, but because they were across the street, a couple guys came over. They ended up handcuffing these patients, and they were going to take him in because they smelled alcohol on him. They didn't think a thing about this car that just knocked them over. They wanted to take this patient in because they smelled alcohol. So this is just a brief snippet on some of the things that our homeless patients face. And it's happened right in front of our clinic. Luckily, 2 of our MAs were there. They were coming back from lunch, and they were able to convince the police officers to release our patient into our custody so we can take care of him. But I just wanted to share with you firsthand something that happened right in front of our clinic. Now let's continue with the type of patients that we see. I'm seeing patients with heart failure, ejection fraction down at 10%. These patients need organ transplants and they're homeless. I'm also seeing homeless patients with cancer. I'm seeing homeless patients on dialysis. Imagine having cancer, being on dialysis, and trying to figure it out on the streets. Where are you going to live? Where are you going to eat? And how are you going to survive? It's really, really tough out there. In addition to this, we're seeing patients that are discharged with PICC lines, they're discharged with Foleys, they're discharged with TPNs, and they're rolling around with oxygen tanks, and they're expected to survive. We're also seeing homeless patients that have serious mental health issues. The vast majority of these patients have been ignored. They've been unwanted, and they know their lives. So it starts wearing on you. So they're severely depressed. They're bipolar, they have schizophrenia, they're suicidal, they're homicidal. I'm also seeing patients that have substance abuse, alcohol abuse, of course. And lastly, I'm seeing a really tough area. There's many of these patients that are discharged with chronic, horrific, uncontrollable wounds that have been around for a while. And they're expected to take care of these wounds out in the streets. Can you imagine being out in the summer, California summer, it's hot, you've got wounds going up and down both legs, and you've got to take care of this wound. It's just not happening properly. So, prior to our collaboration, these homeless patients are discharged from the hospital, and they're sent to the streets. And within a few days, inevitably, if you take a look at all of these serious conditions that are out there, they're going to go back to the ER within a day. Within a day. How's somebody supposed to take care of these serious wounds, discharged from the ER on their own? They're going back into the ER. So we have this vicious cycle. And that's what's been going on. So these repetitive visits back to the ER puts a tremendous amount of strain on the hospitals by burning up valuable resources and affecting the care for the non-homeless community as well. Think about how long the wait times are and the overburdened ERs. Our work at the clinic provides a relief. Our work allows the communities to continue on while our homeless patients are being brought in to get the care that they need. So what are we doing to help our patients? Number one, as a sole provider on site, my job is to keep our patients stable, to reduce the amount of returns to the ER, right? In order to show that we have some value, we've got to be able to do that. So I've got to know what I'm doing. I take a look at the discharge plans from the hospitals to determine if it's appropriate. I'll revise the plans if necessary, depending on the patient's condition. I prescribe medication. I also do wound care. So many of these patients have serious wound care, so we spend a lot of time to make sure that these wounds don't progress, become osteomyelitis, and the patients are going into the hospital. On top of taking care of the various issues that have been presented to us by the hospital, I'm also taking care of a multitude of issues that the hospital has not addressed. Remember, these patients have not had any kind of medical care for a very long time. So they've got chronic issues that also need to be addressed. And above and beyond that, I'm trying to catch these patients up on their preventative care. They haven't been seeing their primary care providers. They're not getting pap smears. They're not getting mammograms. They're not getting colon cancer checks. They're not getting prostate checks. They're not getting updated on their immunizations. They're not seeing the dentist. So I'm trying to do everything I can to catch up for everything that they've been missing. So there's quite a slew of responsibilities that I'm responsible for in a very short time, in 30 days. So let's talk a little bit about the social services. Thank goodness Audrey has been so bright and so supportive. Over time, I was able to have a case manager to support me. And our case manager, Susanna, her job is to help connect our mental health patients with the Department of Mental Health. The vast majority of them have some kind of psychiatric issue, even if it's just severe depression. Now, why is this critical? It's so important because if we can get our homeless patients in with the Department of Mental Health, they have access to resources that we don't have. Eventually, the Department of Mental Health can get these patients into housing, Section 8. And that's the ultimate goal for everybody, is to get off the streets. If we get them off the streets, we reduce the load on the community tremendously. Another area that's highly critical is we assign our patients to primary care providers. And during the 30 days that they're with us, we're getting them used to getting regular care and understanding the importance of taking medication on a daily basis so they can improve. And as everybody knows, it takes 30 days to create a habit. By the time we reach 30 days, we want to continue that habit. So by establishing them with the primary care provider, they will go to the primary care provider to ensure that their health is maintained. And now they no longer are going to the ER and flooding the ER that's unnecessary, or to us unnecessary, but to them it is, with things that are unnecessary. So that component is so important. We're working very hard to get everybody established with the primary care provider. Each homeless patient gets a chance to select if they want to choose us as a primary care provider, especially since we've spent so much time working with them, gaining their trust, showing that we care. The vast majority of patients that decide to stay in this area will choose us as their primary care provider. But remember, we're seeing patients being sent as far south as St. Mary's, as St. Long Beach, as down in Long Beach. We're seeing patients from Henry Mayo. We're seeing patients from San Bernardino. A lot of them want to go back to the area. As much as they like the relationship that they get with me, they don't feel comfortable staying in an area that they're not familiar with. So we have to understand the mindset. And you ask, well, you're going to get all of this if you stay here. Why would you want to leave? Well, you know, where they are, they know where the food is. Where they are, they know where it is that it's safe. Where they are, they know where they can sleep. They have resources, they have friends, people that can help protect them. But when you put them into an area that they're not familiar with, the wrong decision can mean their life. So that's where they're coming from. Most of the time, if they come from Long Beach, they're going to want to go back to Long Beach. The good news is, the vast majority of the patients that we've developed a connection with, even when we're sending them to Anaheim for a shelter, or Bell for a shelter, or back to Long Beach, they're still finding ways to come back to see me for treatment. Because they tell me, I've not been able to find a provider that gives me what you give me. So it's been wonderful in that regard. But still, we need facilities that provide excellent care for these patients, wherever they go. And to continue further regarding social services. So Susanna is also working with the social services team from the Harbor Improved Care Center to get these homeless patients their ID, GR, food stamps, additional sources of income, because they need every bit that they can get. Housing, believe it or not, is so expensive, even when it's for a homeless patient. It's ridiculous. They will cram a ton of patients into a small room, and they charge $600 for that. And if you use water, they charge money for that. It's just, there's so many scams out there, it's ridiculous. So we have to be very careful when we're sending our patients. So with our team working together, we're also looking for where we can place our patients after they leave the Harbor Improved Care Center. Many times they have wounds that are so bad, or conditions that are so bad, 30 days is up, and they're not ready to go. So I do everything I possibly can to contact the hospital and plead with the case managers to allow these patients an additional 2 weeks for them to stay so their wound can heal and that way they can move on. All I need is an additional 2 weeks. If you don't give me the 2 weeks, the patient's going to regress, they're going right back into the ER. And all of the work that we've done has been wasted. So fortunately, some of these case managers understand the logic and they allow it to happen. But more often than not, I'm not getting this. And our poor patients who progress so far are going to be going right back into that cycle again. So let's talk about mental health. At our clinic, we also have a behavioral specialist to help patients with mental health issues. She's there daily. We also have Dr. Schwartz, our psychiatrist, who's there 4 hours a week. Now for patients with HIV, we connect them with the HIV clinic. For patients that have substance abuse, we're connecting them with the treatment center. Now let's talk about something that's a little different. Might be a little weird. I strongly believe in having many tools in my toolbox to help my patients. And I'm not closed-minded. I believe firmly in using alternative medicine. For patients that have psychiatric issues, anxiety, insomnia, pain, I found that meditation is a wonderful tool to teach these patients, especially for coping. You can just imagine the amount of stress that these patients are under. If we can find ways to relieve the stress, we can help them heal, we can help them come up with better answers. So I learned the technique from Dr. Richard Brown. He teaches at the UCLA Alternative School of Medicine, and his technique combines breath work along with visualization, and it was really fascinating. They did a study monitoring cancer patients utilizing these techniques for 90 days. And after 90 days, they found that the cancer patients, they're depressed, they have anxiety, they have severe pain. They were able to reduce the amount of medication that they've been taking in half. So I found that to be so wonderful, and I thought, you know what, I'm going to try to incorporate this and adopt it and apply it to my patients with cancer at the facility. And I've gotten tremendous results. So at this juncture, I decided let's open the door up to all of my patients, anybody who's willing. And I've been teaching them meditation. I've been teaching them group meditation as well to improve healing, to improve situations with insomnia, anxiety, depression. And they love it. They come every single day to participate in meditation. So, as you can see, I wear many different hats, and I play a lot of different roles. In order to be successful with our patients, you have to. You can't be rigid. You know, one of the roles that I played is that I'm a leader. One role is I'm a mentor. One role is that I'm a friend. But the most important role, I believe, is the role of the advocate. It's so important for me to be an advocate for my homeless patients, fighting for all of the critical things that they need. My name is Johnny Moyer. I'm a nurse practitioner, and my time is up.
Thank you so much, Johnny. That's you've definitely, I commend you for your compassion and your passion for these types of patients, and clearly you have very challenging patients. On a lighter note, my name is Dr. Linda Detta. I am a board-certified nurse practitioner with a background in cardiovascular care for 20-odd some years. You know, you open up chest walls at the bedside a few times and you think about, you evaluate your life. And so I thought, how could I really sustain this for the next 40 years of my life as a professional woman? And I thought about just going back to the academe, so I took my master's degree at UCLA to become a nurse practitioner and to leave the acute care setting. So I was thinking about really going into ambulatory care. Well, you know, lo and behold, it's amazing what your interest is. You basically are redirected to what you're trying to avoid from sometimes. Lo and behold, I was hired at a big major hospital here in the San Fernando Valley area. I was one among the pioneers or a trailblazer to work as the first intensivist in this hospital. I worked with physicians and nurses and families, and I just loved it. I was single then, so I worked 18 hours. So much for being paid so well. I also worked weekends, but I loved the interaction with my patients, and I just knew that I was in the right place. Well, after about 3 years and working so many hours and making so much money, I couldn't travel. I lost my friends, and so I thought, well, I'll quit. So I quit. Yes, I did. With no job in sight, don't do this, Mikhail. With no job in sight, I traveled for 3 months just to reevaluate my life. I needed to just get my life back. My sister calls me and says, what are you doing with your life? And I said, well, I'm happily traveling. Yes, but your bills are happily piling up. So I came home and I had to just again reevaluate my life. I got a call from the faculty from UCLA and said, Lynn, there is another opportunity for you that you might like to try. I looked at the Los Angeles Times and there it was, in college health. And I said, ugh. I'm an internal medicine is my background. Why would I go to college health? But I did, and I did the interview, and I made it very clear I had no ambulatory care experience. I definitely told them I do not. It's do not hire me. But after a few weeks, they needed somebody also to be a master's level prepared nurse practitioner, so I was the very first one there. I actually loved my role, and the reason for that is the population. I have the worried well, and you might think, I hear most of you say, I hear you say, I take care of Alzheimer's patients. What makes it so meaningful for me and purposeful for me is the fact that I am a clinician, and I've seen patients, and aside from the fact that I'm able to take care of their medical health, so that they can really succeed and have their academic lives. It is really exciting to hear from them. I become a bridge. The nurse practitioners in our clinic and physicians are all board certified, and we have specialties in primary care, women's health, sports medicine, orthopedics, dermatology. You would not believe it, but we have men's health. Our population is so unique, and the reason for that is we are even taking care of trans care. We're doing transgender care in college health. Can you believe that? It is really pretty amazing. And it only goes to show that our generation is definitely changing, that the arena, healthcare is just not being a clinic anymore. And so Johnny was expressing about, homeless. We do have homeless students, and if you are enrolled, if you are a pre-matriculated student, you're eligible to have all the services aside from student health services. You have counseling, you have the student rec center, which is really beautiful, and they avail all those services. It's part of their tuition fee. So our homeless would either have their showers there, and so they live in their cars. We have food insecurity. We are now looking at our basic needs and our basic initiatives for these young folks. And we're finding out they're not eating well. And these are the things that we need to address. So aside from the fact that we take care of their medical issues, and again, these visits are typically episodic because of our executive order, we take care of fairly complex patients as well. We do have patients and students who are in their 70s and their 3rd or 4th year careers. It is so fascinating to me. And again, these are the lifelong learners. And I ask them, so why are you actually having a degree in engineering? And they said, I'm here for the healthcare. But let me just give you an example of one of the highlights in my career as a clinician, and being a cardiovascular nurse, and again, we are supervised by our supervising physicians. I knew a complete heart block. I knew it. And the physician said, no, this is not heart ball, this is Wiki ball. And I thought, you know what, I would bet my license on this one. I actually went against my supervising physician, and I told this young lady, this 21-year-old lady, to go to all of you. She had a pacemaker that evening, and I'm sorry. The next morning, her mother calls just to say thank you. That was the best time in my career for a mother to say, thank you for saving my daughter. I will never forget that. I still receive a Christmas card every year. It's the most amazing thing. Our students graduate within 4 years. That's our goal. Unfortunately, they become chronic students, and they graduate at about 6. We have 23 campuses in the system. Northridge, I could tell you, is one of the best campuses out there. I take pride in the care that we do. I take pride in the fact that I'm not only a clinician, but my role now is so different because I'm also an administrator. I am now in sort of the back end, so to speak. I'm not on the front lines anymore. But I get to hear and really feel the pulse of my students, of our students, what those needs are, what do they actually need to get better. So they need better coping skills. So we need to take care of them so that they can make better life choices. These are important. They need to learn how to care for themselves. We bridge that gap because most of the time we are their first contact when they're away from home without a parent. We become the parent, the advocate, similar to what Johnny was saying. We are their mentors, and if there's anything else too, it's about 60%, and this is what is so wonderful about us nurse practitioners, is the time that we spend to teach our patients about choices, the better choices that they can make about, for me, my population, their drinking issues, if they do have that. We have issues of sexual violence. You could not imagine the calls that we've received during the Kavanaugh time, and remind me, Dr. Blasey Ford. You know, these are the things that we actually have to take care of every day. A woman who comes here, who comes to the clinic to say, I've been sexually assaulted by my acquaintance or a friend, a date rape. 60% of our patient population, the APA actually is saying that most of our students coming in now also anxious, stressed, and also medicated. Our mental health issues out there in college health, ages 18 to 26, are actually really high. And the reason for that is, this is so different from my generation. All I had to do was go to school. Do well in school, I'm done. These students actually have financial issues, relationship issues, they work full time, they carry a full load. So when we get them to say, you know, I'm really exhausted and fatigued, this is their daily lives. And so I have to tell an example today, which is, I think, is really interesting, because some of them would say, what's your chief complaint? Oh, it's a personal concern. Okay, so I have high blood pressure, this young man says. I saw him today, he's 22. His blood pressure was 149/88. So I said, what's going on? And he said, can I buy emergency contraception here for my girlfriend? So I said, okay, young man, what happened exactly? I had unprotected intercourse yesterday. And I said, is this why your blood pressure is high? He said, it is really killing me. And where is she? Well, she's in Los Angeles. And I said, that's not a problem. Let's take care of you. So I went ahead and asked about the risk factors, because that's all what we have to do, right? And I told him about what he needs to do to be safe sex practices, etc., STI prevention, etc. I escorted him to the pharmacy, got the emergency contraception. I let him sit down. I remeasured his blood pressure. It was 120/82. But just to be on the safe side, I went ahead and said, I'm going to call him next week to see how things are going. I even scheduled for a physical exam just to be sure that he's definitely all right. So our population